I am journalist Bipin Sharma and I am here at the India International Centre, New Delhi for a special event. This event hosted by Delhi Medical Association to commemorate and to celebrate Doctors' Day celebration. And as we know that Doctors' Day is celebrated with all pomp and show, with all enthusiasm every year on July 1st as a tribute to the late healthcare stalwart Dr. B.C. Roy. And this year, being no exception, Delhi Medical Association went that extra mile and hosted a grand event at the ISC New Delhi. There was a scientific session followed by awards and felicitation ceremony. And Dr. Alok Bhandari, President, DMA, and Dr. Girish Tyagi, President, DMA-elect. And then, of course, Dr. Prakash Lalchandani, Honorary State Secretary, and Dr. Ramesh Datta, the Chairman of the Doctors' Day celebration here at the IIC, and along with Dr. Mukesh Verma, Co-Chairman. And there was a very special talk by eminent family physician, Dr. Naresh Chawla, who is also the Vice President of Delhi Medical Council and the past President of Delhi Medical Association. And he spoke on geriatric and palliative terminal care. And the talks by eminent healthcare stalwarts during the course of the event here at the ISC evoked an overwhelming response from all the attendees. And no second thought that this splendid initiative by Delhi Medical Association adds another feather to their golden cap. Good afternoon, friends. So today we have the pleasure to introduce Dr. Naresh Chawla, who is a renowned healthcare stalwart. He needs no introduction. He is the sitting Vice President of the Delhi Medical Council. And DMA, as we know, is celebrating Doctors' Day today on July 7th. So normally it is celebrated every year on July 1st. So the DMA is celebrating today at the India International Centre. So we would like to know from Dr. Naresh Chawla, who is an eminent medico-socio activist and a very noted family physician. So first of all, Dr. Saab, why don't you explain to the viewers of 10 News the significance of Doctors' Day?
You see, in India, Doctors' Day is celebrated every year on 1st of July, and it is celebrated on the day is a B.C. Roy Day. B.C. Roy was the first Chief Minister of Bengal, and he is best known doctor of India. It is his birth as well as death anniversary the same day on 1st of July. So he was a very caring physician. So India celebrates his birthday as the Doctor's Day. Delhi Medical Association this year started with on 30th of.
So Dr. Naresh, first of all, as you have just explained the significance of Doctors' Day and why this event is celebrated every year with so much of enthusiasm, and there is so much of interest amongst the masses. So the important question that comes to mind is, why don't you throw some more light on the talk session that you had today? Because you spoke basically on the significance of geriatric care, palliative care, and then the need to address the cause of the terminally ill patients.
It's very important. My talk today was on the role of a family physician in geriatric patients and also the palliative care in terminally ill patients. What does it mean? A geriatric patient, let me tell you that the senior citizens, that means people who are above 60 years, they practically form 10% of India's population now. They are around 15 crores. But it is expected by 2050, there will be almost 37 to 40 crores, forming almost 25% of Indian population. So we have to be adequately trained and appropriately trained for dealing with this geriatric population, because the senior citizens or the elderly people have special problems. Their organs are aging. That is one part of it. Second part is when a person becomes terminally ill. Terminally means we know that he is suffering from a disease which cannot be completely cured. It could be chronic heart disease, chronic lung disease, chronic kidney disease. It could be terminally. It could be hepatitis, HIV. It could be some cancer. It could be any disease in which we feel that the patient is moribund. Moribund means that we cannot totally cure him, but that has to be properly nursed and treated. I feel the role of a family physician in these circumstances, avoiding all the high expenditure of the tertiary care, top corporate hospitals. If such treatment is done in a smaller setup under the care of a family physician, the treatment will be very inexpensive, plus patient will be close to his near and dear ones, and we do not know how long it takes, and we can avoid all the extremely expensive hospital care, and patient can get well, and the near and dear ones have the satisfaction that they will look after their patient well.
So what is your message for countless family physicians, especially the young family physicians? What their focus should be on, and how should they go about treating patients all over the globe?
Very good question. Today the message I gave in my talk was extremely important, that those general physicians, family physicians or family medicine specialists who till now are doing all the general role, they get themselves adequately and appropriately trained in geriatric medicine and palliative care of the terminally ill. What does that mean? Patient is admitted in a big hospital. Patient, we come to know that it may take any long, but patient cannot become completely alright. It is a total moribund patient. So if this physician, general physician, gets a training and starts treating patient at patient's home or at the doctor's clinic or some shorter setup or smaller setup, the expenses will be much less. The near and dears, अक्सर ऐसा होता है, लोग कहते हैं डॉक्टर साहब पेशेंट का फायदा तो अब होना ही नहीं है, इसको अपने घर ले जाओ, इसकी केयर करो. लोग हमसे पूछते हैं, पेशेंट्स आस्क अस, डॉक्टर साहब हम क्या करें? तो इट इज द सिचुएशन where a family physician take this challenge, a very satisfying job, and keeping the, after all we know very well that the person has to die, but a honorable way to die will be when he is adequately treated and he gets a proper send off to.
The viewers would like to know more on this, the fact that India is on the threshold. I mean, they say that India is on the threshold of becoming the diabetes capital of the world. Is it a myth or is it a reality in the near future?
Very good question. The matter of fact, India was host to a lot of infectious diseases and it still is. We have the worst of viral fevers, we had the worst of corona, we had the worst of all the dengue, chikungunya and all infectious diseases. But unfortunately, we also are host to now all the lifestyle diseases whom we call non-communicable diseases like diabetes, hypertension, dyslipidemia, all the chest and airway diseases. So we have a double burden now. So we are called a diabetic capital of India, but I think that's not a very proud title. We have not to be called a diabetic capital, we better be called a diabetes caregiver capital. That would be much better. So our family physicians have to train themselves in treating all these conditions. The so-called super specialists and endocrinologists and diabetes specialists are not too many. The family physicians, if adequately and appropriately trained, can take up the role of all such diseases, also of the treatment of all the terminally ill patients, all the palliative care of the moribund patients. If this void and the gap is filled, I am sure the people will live happier and they will be dying in a very honorable manner.
As a noted healthcare stalwart of the country, Dr. Naresh, what do you have to say regarding India becoming the most ideal medical tourism destination of the world, and what efforts need to be there in place in order to make India one?
Very, very important. Let me tell you, Indian doctors world over are known as the most skillful doctors. because of our exposure to myriads of diseases during our graduation and post-graduation and our clinical experience thereafter, we are the best doctors. The best part is our setups are most economical. The government needs to give some such permissions or needs to market this thing in an adequate manner so that more and more foreign tourists, not only from the lesser developed countries like in Africa and other parts of Asia, even the developed Europe and America, we do receive such patients because we are far more inexpensive as compared to very expensive treatment in the Western world. So I would say India is on the threshold of becoming a medical tourism country, and it can be further helped by the proper ministries by giving proper permissions and promoting it all round. It can be combined with the other tourism. The person will come here, he'll get the medical treatment, he'll go around the country, and India can have a lot of foreign exchange. I think it is a long due step by the government of India. Better it be done earlier than better.
Perfect. So one more thing, which is there on everyone's mind, that a lot of ailments today are owing to the sedentary lifestyle and bad eating habits. Dr. Sahab, throw some more light on this.
This is very unfortunate that our Indian children particularly, the people who have a very impressionist mind, see on media, then they take up to just junk food. Eating pizzas, burgers and momos, taking of coke becomes their lifestyle. So unfortunately, the number of such people, it is adding to childhood obesity, it is adding to obesity in adults also, and also it is contributing to diabetes, dyslipidemia, hypertension, and myriads of other diseases. It is very unfortunate, and this trend has to be reversed by not one person. The governments, people, citizens, NGOs come together, promote more physical activity, proper diet. I think it is most required as a long-term measure for the health of India.
So one last question, Dr. Naresh, you've been a crusader, in fact a long-time crusader against vandalism, attacks on doctors, and medicine we know is the noblest of all professions. So what effective steps need to be taken in order to get rid of this menace?
Indian Medical Association has always opposed the assaults on medicos at their place of work and on their certificates. Is most unfortunate despite existence of adequate laws, because the government has not taken it in the right spirit. Although Amit Shah ji, who is the Home Minister of India during the Corona, did apply it, but that was only doing for that duration only. We are still advocating for a proper act to be brought in the parliament and to be implemented. Otherwise, the morale of the healthcare professions is going down. If I treat a patient who is about to die and I touch him, he dies, what will happen? Next time I will not even touch it. So we will resort to defensive medical practice, and lots of patients will die and spend much more money. So there is a dire need to protect the right of a medical professional to practice in a dignified manner without the fear of any assault.
Perfect. So heartfelt gratitude to you, Dr. Chawla, and for imparting such invaluable information, and for the benefit of the viewers. You know, it is imperative on our part to share that Dr. Naresh Chawla played a pivotal role during the COVID outbreak, and he emerged as a real COVID warrior, where the doctors were treated as angels in white robes, and in fact they went that extra mile to ensure that patients in their most critical period were given the best of treatment, best of medical advice. So wishing you a very happy Doctor's Day, Naresh Chawla. We thank you so much.